Hey guys, this is Dr. Saumil Shah. I'm a plastic surgeon at Skinzone Aesthetics, and today we have a very special guest, Dr. Girish Shah, who will be talking with us about a very specific problem that we have in India, which is called as vitiligo. It is also has other monikers such as, or called in other ways, such as khod in our local languages, and it is something that is a very big societal problem, though not a big medical problem. So let us get to know more about this disease called as vitiligo, and this is the first video where I'll be speaking about more in detail about it. We have two other videos after this where I'll be speaking about the treatment of vitiligo and the different surgical procedures that are associated with vitiligo and who are the patients for it. So let's get into it. A big welcome to Dr. Girish Shah. He's the founder director of Skinzone actually here at Mumbai. What exactly is vitiligo, or khod that we know it as?
Yeah, thank you for your introduction. Now see, vitiligo or khod is characterized by the presence of white patches on the skin. Now these patches are very clear, well-defined patches, can occur on any part of the body, and it stands out so much so that patient is called this as kind of cosmetic problem for them. Now it is important to discuss about vitiligo because vitiligo is considered to be a kind of social evil, and there are so many other diseases which can mimic white patches and vitiligo. For example, say people develop, especially children below the years of 12 years of age, develop white patches on the face. And this is mainly because of allergy. This is known as pityriasis alba. Similarly, there are other diseases like fungal infection that occurs on the chest and back. It is presented as a white patches on the skin. This is known as pityriasis versicolor. Again, because our climate is very hot and humid, it is very common condition and need to be differentiated from vitiligo. Third important disease is leprosy. Leprosy is again presented as a white patches on the skin. It was very common disorder in India. Large number of people even from affluent class suffered with leprosy, and hence leprosy was many a time considered to be similar to that of vitiligo, and hence it is got to be differentiated from vitiligo. There are many such other diseases which especially in the skin, like say for example depigmented patches on the skin which comes as a birthmark. So even birthmark can be white in color. So these are got to be differentiated from vitiligo.
Right. Okay, so basically a white patch is not always a vitiligo. There are many diseases that can mimic a vitiligo disease. So you need to get to a dermatologist and get to know whether it is vitiligo or not before you start thinking as to what the treatment is. Is vitiligo contagious? Or by contagious I mean, can it be spread from one person to another, say like a cough or cold does? So is vitiligo contagious?
Doctor, this is not contagious disease. It cannot spread from one person to another person. It is totally safe. It is only, it could be familial in nature. It can spread from if parents have this disease, then child is likely to get this disease. But otherwise, it does not spread from one person to another person like that is seen in the leprosy or kushtrog.
So even if it does not spread, then why is it still such a big societal problem where people come to us all the time, say before marriages and as soon as they have in an exposed area of the body, we get patients who are panicking and they come to us. We have parents of children who come to us panicking that my child now has a white patch on his body and please cure it no matter what. And even from good families, educated families, we still have patients coming in. Why is that? Why is it still such a societal problem?
See, basically, if we look back, centuries ago, kushtrog or leprosy was very common in India. Large number of people suffered with kushtrog and leprosy.
Yes.
Now, kushtrog is a contagious disease. It spreads from one person to another. It is also associated with certain other problems like lack of sensation on the hands and feet. It leads to disfigurement of the hands and feet, and it is also associated with lot of other uh, skin problems. And it was very difficult for people to differentiate between the white patches of vitiligo from white patches of a kushroga or leprosy. And so many times vitiligo was considered synonymous to that of leprosy, and so people still carry that particular taboo, that particular feeling that okay, white patches means leprosy, or white patches is something which is transmitted from person to person,
And it is still bad.
and it is still bad. And second thing, it has lot of cosmetic problems. Our color is black or dark in color, and on dark color, white patches stands out. It gives very ugly kind of look, and that also has lot of psychological impact on the people. And that is why it is considered to be a bad disease, a disease where they require immediate treatment.
Right. So basically, vitiligo now is very easy to differentiate, or not very easy, but you need a dermatologist to differentiate it. But for dermatologists, it is quite easy to differentiate between vitiligo and leprosy. Leprosy is not that prevalent or that common now in India as it was earlier, and vitiligo is still going to be there because it is not related to how contagious it is. So the stigma associated with any white patch is still there in our society, and that is why there we get patients who come for treatments and they want these treatments to be done. So that's it for this video on what is vitiligo. In the next video, we'll be going about as to what are the different treatments that we have for vitiligo, and after that, the surgeries for vitiligo. So see you there. Thank you, doctor.
Thank you.
Yeah.